Hi everyone, my name is Sarah Clancy, and when I graduate medical school, I would like to become an anesthesiologist. In this field, there are countless dilemmas that these physicians go through each day, and therefore I will discuss just one of my many ethical dilemmas found in this field in my presentation today. Anesthesiologists are trained physicians who administer anesthesia and medications during surgeries. After medical school, anesthesiologists must complete their 8 years of residency, become board certified by the American Board of Anesthesiology. 75% of these anesthesiologists are private practices and are ABA certified. In anesthesiology, there are 4 branches of practice. Cardiac anesthesiologists specialize in the care of adult and pediatric patients undergoing cardiothoracic surgery. Obstetric anesthesiologists specialize in epidurals during childbirth. Pediatric anesthesiology deals with the pediatric surgery field, and general anesthesia deals with all 4 branches. With the initial research process, I was able to piece together a valid research question for my ethical dilemma in anesthesiology, which is, when a patient is terminally ill, is it ethical to administer a prescription of medication that ends their lives? This question brought me forward to choose which side of the question I believe is correct. In this decision process, I was able to determine my thesis, which is based on the knowledge obtained through thorough research. I would not choose to end a terminally ill patient's life. This decision is based off the following pieces of evidence that can be found in the next upcoming slides. My first concrete detail is that a doctor's job is to do no harm when treating a patient. Doctors are held under Hippocratic oath, which states to do no harm. Ending a person's life breaks this law of morality and changes the doctor's services from a caregiver to a service provider. The second set of evidence which supports my claim states, in situations with terminal illness, there are ways, such as palliative care, to reduce discomfort. Palliative care has been shown to decrease rates of depression and improve the quality of lives. This care allows for families to spend their last few months in peace together. The interview of Dr. Doe Flinger supports my thesis by stating that physicians' bedside manner and the ability to know how to deal with ill patients affects others. In countries that have legalized physician-assisted suicide, show that sick patients often opt out in taking the drug because their doctors suggested to help benefit their family's needs. The legalization of physician-assisted suicide led to the slippery slope of patients ending their lives for reasons other than themselves. If this occurs in the United States, patients lose their overall quality choice to live, which is a human right, and their choice may end up with their lives gone because of their doctor's choices. During my initial research phase, I ran into a few small difficulties. When I first started working on this project, I was stuck on where to move forward and find up-to-date dilemmas on anesthesiology. Another difficulty was for me to decide on which side of the ethical dilemma to write about. I overcame this when I chose which side of the argument I supported. Some of the things that I found easy when researching was that I was able to find various credible sources that were unbiased pretty quickly. Another thing was that it was easier for me that once I found a slide to support, I found many different articles which supported my claim. In the future, I will use a crack test to help find out if sources are reliable before using them to better protect my research processing. And also, I won't put off the decision to choose which side of the ethical dilemma to support by following my own viewpoint of the article. Thank you.